Hello and welcome. Thanks for joining us today. In today's video, we'll be discussing, are bones safe or not? We'll cover why bones have been used in the past for dogs and cats, what benefits they provided. We'll also cover aspects of feeding bones that owners need to be aware of to make an informed decision whether or not you're going to give your dog or cat a bone to eat or chew on. Now, if you stay until the end of the video, we'll also cover some other options instead of using bones that provide similar benefits to what bones do for your dog and cat. Hello and welcome to Dr Pawfection. My name is Jason. I'm a veterinarian. Here at Dr Pawfection, our aim is to improve the quality of your pet's life by sharing veterinary information with pet owners so that they can become educated on topics of animal health and well-being. Okay, let's get on with the video. Now, when I was a veterinary student about 20 years ago, the recommendation was to feed dogs and cats raw bones to keep their teeth clean. Chewing on those bones and chewing the meat and gristle off would be what brushed the teeth. And yes, it does work. However, in veterinary medicine these days, bones are no longer recommended because we know that bone is much harder than the enamel, the outer layer of teeth. And dogs chewing on bones may chip the enamel off or break their tooth. And it's also possible in cats too. So in the old days, bones used like marrow bones for dogs, beef marrow bones, etc. And in cats, it used to be raw chicken wings or raw chicken necks. Now, we do know that enamel can be broken or chipped off teeth chewing bones. That's why they're no longer recommended. While we're on the topic of bones, please never use a cooked bone. Cooked bones are even more dangerous than raw bones. In the process of cooking bones, bones become more brittle and they're more easy to break into sharp fragments. Now, if your dog and or cat chews them up and breaks them into sharp fragments, there's a few scenarios which could happen which are far from ideal and in some cases life-threatening. If sharp fragments are produced when a dog chews a cooked bone, they can cut the esophagus or the gastrointestinal tract on the way down, causing pain and discomfort and bleeding. They could also become stuck and pile up in a part of the intestine, preventing food and water from getting past. Now, if this occurs, what you'll see is an animal who stops defecating or pooing and starts to vomit after eating or drinking. The worst scenario of all would be where the sharp fragments cut through the intestine, causing a hole in the intestine. And what happens is then gastric contents leak into the abdomen, and depending on where in the length of the intestine it is, it may be food and bacteria and saliva, or fecal type material could leak into the abdomen. And this can result in a condition known as bile peritonitis or bacterial peritonitis. These require expensive surgeries. So again, please avoid the expensive bills and save your dog or cat from such horrendous, painful conditions. Now, back to raw bones. If your dog did chip or break its tooth by chewing a raw bone, the problem with a broken tooth is two issues. One is pain once you've broken a tooth if the nerve is exposed. If any of you watching have ever broken your tooth, as I've done myself, if the nerve's exposed, it's painful. Anything hot or cold is very uncomfortable, and chewing can be painful as well. Not to mention, you often end up with a sharp edge, so your tongue and your cheek may actually be damaged if they come into contact. Unfortunately, there are only two options available. One option is to have your veterinarian remove the tooth and stitch the socket closed so that there's no longer a risk of bacteria entering the bloodstream through a damaged tooth. The other option is to have a veterinarian, either a veterinary dental specialist or a veterinarian who has special advanced skills in dentistry to perform a root canal on your dog's tooth if you wanted to try and preserve the tooth and not have it extracted. Root canals are very expensive, so again, another reason to avoid bones of any sort or other really hard material, things like deer antlers and some of those really hard dental chews that some pet stores sell, I'd probably recommend avoiding them. It is not my intention to scare you, merely to educate you so that you understand why these foods and various other things pose a considerable risk to your pet's health. And knowledge is power, in my opinion. So if you understand and know why, then you know what to avoid. So again, we're only here to try and help improve things and make life easier for yourself and your dog or cat or pet. Today, in this part of the video, I'd like to discuss the issues relating to feeding raw meat and, in some cases, raw bones. What are the risks, if any? Now, all going well, raw meat would usually have very low bacteria numbers on it. However, sometimes in the abattoir processing, bacteria might get through from the skin or the carcass onto the meat itself. And every time a cut is made into the meat to produce a smaller size portion of meat, if bacteria is on the initial surface, it can then be transferred onto other surfaces. What this means is then that probably the meat with the most potential to cause problems is if you had mince meat and there was bacteria on the surface. Mince meat is essentially like taking a steak and cutting it 1,000 times, if you like. You dramatically increase the surface area that may be exposed if a bacteria was present initially at the beginning of the processing. So chicken mince, beef mince, if bacteria got in, they're more likely to have a larger number of bacteria on them than a steak or a fillet. Now, ideally, the meat is free of disease-causing bacteria, but sometimes there might be a breakdown in the procedures in the abattoir, and the abattoir process workers might have made a small nick or cut without realising in the intestine or in the large bowel. If that happens, what may happen without anyone realising is small amounts of bowel contents or small intestine contents may splash or spill onto the meat that they're processing, and you could end up sometimes with some very unpleasant bacteria getting on to the meat. Species like E. coli or Escherichia coli, Campylobacter species such as Campylobacter jejuni, and also Salmonella species. Salmonella can be fatal if an animal or a human gets a bad enough dose of it. Now, the problem with raw meat is that it then goes into the animal and there's been no reduction in bacteria numbers. When we cook meat, usually the cooking process, whether it's boiling or roasting, destroys the bacteria due to the heat and often destroys a number of the toxins or poisons, if you like, that the bacteria produce. There are some bacterial toxins that are heat resistant and may get through some cooking processes and still be a problem. But in general terms, cooking dramatically reduces any bacteria to virtually none, and most toxins are destroyed by heat. Now, the other problem feeding meat on its own is meat's calcium level is actually low compared to the phosphorus level as far as the calcium to phosphorus ratio goes. So this means dogs and cats fed a high meat diet may end up, if they're eating enough meat on its own, they may end up eating a calcium deficient diet. Now, calcium's a metal that is required in the diet for a number of functions. Obviously for teeth and bone formation in growing animals, and also for nerve and muscle function in all animals. Now, if the body is low in calcium, the body will look around to try and find other sources of calcium it can get, because if your nerves and your muscles are not functioning, that will ultimately be a fatal or terminal condition. The body will recognise if there is a calcium deficiency, and it will then liberate calcium from the bones. So if your pet is on a high meat diet over a period of time, the bones may actually be losing their calcium content to supply the difference in what's lacking in the diet. And some of these dogs and cats may end up with a condition similar to osteoporosis. They can get weak, chalky bones. The most was informed of was colleagues, specialist surgeons, where I used to work, had a tiger cub who'd broken its leg. It was presented to them to have a fracture repair. They were screwing the plates in to stabilise the fracture, and the screws were just not biting into the bone. The bone was sort of crumbling somewhat, or not gripping the screws as they should have. They finally got the procedure done, and they said to the owner of the tiger, "What are you feeding it?" And he said, "Oh, I'm feeding it I'd chuck it a side of beef." And they said, "Yeah, what else are you feeding it?" And he said, "Oh, that's all I give it." And they said, "The diet's inappropriate. The tiger's actually calcium deficient." So that's sort of an example of what can go wrong. There are several products here which can assist in improving dental health and cleaning your dog's teeth that do not involve brushing. Products behind the toothbrush and toothpaste in the front here. So starting from the left, we have Greenies, which are a dental chew. Then we have Royal Canin Medium Dental Care, which is a dental biscuit designed to brush the teeth and remove plaque and tartar. And then next to that we have Hill's Prescription Dental Care TD. The T/D stands for Tooth Diet. And finally on the right we have the Oravet Dental Hygiene Chews, which are designed to brush your dog's teeth and help remove plaque and tartar. I'll now go into the specifics of each one. Here we have Greenies, which are a canine dental chew. They were the first treat to receive the Veterinary Oral Health Council's seal of acceptance for control of plaque and tartar buildup, but I do vary them with some of the other options as well. And as you can see here, it's literally a toothbrush-shaped chew. The size of the treat varies depending on the size of the dog, and if we zoom in a little bit onto the bag, you'll see that for this particular size treat, it's for a dog that's 25 to 50 pounds, or in metric versions, 11 to 22 kilos. But these are something which are worthwhile trying, ideally probably daily, until you get to a point where the plaque and tartar aren't visible, and then you might be able to reduce it to every second day. I certainly use these with my dog Jasper. Alright, so I've got Jasper here today. So I just wanted to make a quick video to demonstrate Greenies and how they work by how much effort's required to actually chew them. So I'll just bring in, so here's a Greenie here, and just turn away so you can see that. And Jasper's about a 9-10 kilo dog, or in pounds about 20-22 pounds. So I'll give Jasper this, and we'll just see how he goes chewing this. So as you can see, unlike some supermarket brand dental treats, the Greenies actually take a bit of effort to actually chew through. And because of their texture and the effort required, that actually brushes and helps remove plaque from the teeth. Anyway, I won't take up all your time to watch him chew the entire Greenie, but I just wanted to give you a bit of an idea of how much difference there can be between dental treats. But anyway, I hope this was helpful, and have a great day. If you're interested in buying these, there's a link in the description below in the video. Won't cost you anything, but the channel may get a small commission. Okay, we'll now move on to the next product. Now, the product in front of your screen is Royal Canin's Medium Dental Care Biscuit for adult dogs of a medium breed, 11 to 25 kilograms, roughly 22 pounds up to about 55 pounds. Especially suitable for dogs which are prone to dental sensitivities and where plaque's more likely to build up on the teeth. There's some breeds you see this more often in general practice, especially poodles and poodle cross breeds seem to certainly show up more often in my consults with plaque building up faster than other dogs. They're a complete nutrition kibble, which means they can be fed as the main food. You don't need to add anything else to the diet. They're formulated with a specialised texture that gently rubs the dog's teeth as they chew. Formula also has a chelator, which is a chemical that binds calcium in the mouth. The effect of that is it helps reduce tartar accumulation on the teeth. Tartar is where plaque, which starts off as a stain on the teeth, becomes a harder material, more like sort of cement or grout-like material. Calcium from the saliva gets incorporated into the plaque. There's a chelator which binds the calcium in the mouth and helps reduce the tartar accumulation. Calcium naturally occurs in saliva. It's just when you've got plaque present, the calcium attaches to the plaque and converts the plaque into tartar, which is a harder material which inflames the gums even more. Before we go, I'll just bring this in and show you the size of the biscuit, if you can. Probably about the size of my small finger. And the way they work is as the dog chews through these biscuits, they mechanically rub against the teeth. Instead of disintegrating like a normal biscuit would, these dental biscuits rub and brush the teeth as the dog chews through them. There you go. So you can see up a bit closer there what they look like. Okay, hopefully that's helpful. We'll move on to the next product. Here is Hill's Prescription Diet Dental Care T/D. The T/D stands for Tooth Diet. These are a dental biscuit. These biscuits have been awarded by the Veterinary Oral Health Council the seal for the control of plaque and tartar in dogs, and also, not this variety, but also their cat variety has also been given the seal for removal of plaque and tartar in cats as well. So we'll only give the seal if they've actually demonstrated that the product actually does remove plaque and tartar. These are a larger dental biscuit compared to the previous one we just showed you of Royal Canin's medium dental care. These are prescription also, so usually you either need a letter from a veterinary clinic, depending on which country you're in. Sometimes you can buy these online. I'll leave a link for some of the countries where you can get them. But I'll just actually bring a biscuit a bit closer and you'll have a look and see the size difference. So you can see the size, they're sort of nearly as wide as two of my fingers, I guess. This particular size biscuit is for a dog over 10 kilos or 22 pounds in size. There is a smaller version for dogs under 22 pounds or under 10 kilos in body weight. Similar to the other dental biscuits, these actually brush against the tooth as the dog chews through them. Normal biscuits, as I've said earlier, just disintegrate when a dog chews through them, but these biscuits actually mechanically rub against the tooth and don't disintegrate due to the way they've been formulated. They also have a chelator in them which helps reduce the amount of calcium in saliva and slows down the rate that plaque may be converted into tartar. I do use these with my dog Jasper. I'll use this and then sometimes I might vary and go to one of the other versions just for a bit of variety, but Jasper's happy to eat these and most dogs I've found enjoy these. Alright, so that's the Hill's TD biscuits and I demonstrate mechanically how they actually do remove plaque with, we might use a screwdriver and some whiteout. For this part of the video, I just wanted to try and demonstrate how these dental biscuits actually work. So we'll assume this screwdriver here is an actual tooth. We use some whiteout to be the plaque or tartar. So I'll just give it a bit of a shake. I'll do this in front of you. We'll paint the surface with some whiteout and we'll just let that air dry. I'll sit that down here for a little bit. Then we'll come back shortly and we'll just see if the biscuit is able to actually remove some of that whiteout. So we'll be back shortly. So in this demonstration now we've got the simulated tooth, the screwdriver. You can see the whiteout's dried on it, which is representing the plaque on the teeth. Now if we assume that the actual tooth is here and here's the biscuit, as your dog chews through, if we just put a bit of pressure in there, the biscuit's not shattering, as you can see, but it's actually rubbing against the tooth. And if you have a look already at the screwdriver there, you'll see that it's actually already pushing the plaque up off the tooth, if you like. And I'll just pass it through the biscuit once more. So hopefully that shows you that there's mechanical rubbing against the tooth, which is what physically removes the plaque and the tartar to a degree. You can imagine if your dog's got a bowl of these in the morning or evening and he's chewing through, that's how the teeth get cleaned. So hopefully that was useful, and it gives you a bit of an idea of how these dental chews, or dental biscuits rather, differ from routine dog biscuits. A normal dog biscuit would just disintegrate as your dog chewed through the biscuit, whereas these dental biscuits actually mechanically rub against the tooth each time the dog chews down with its tooth. Okay, well, thanks very much for watching, and if you found that useful or educational at all, please consider hitting the subscribe button or the like button and help the algorithm of YouTube learn who might find this video of use to them. The final product we have in this video is the Oravet dental hygiene chews. As you can see, these are a rectangular shaped dental chew. The Oravet chews do two things. They clean the teeth and also freshen the breath. But they also create a barrier to help protect against plaque, calculus and bad breath by using an ingredient called delmopinol, which works to form a preventive barrier that blocks bacteria attaching to the tooth and the formation of plaque and later calculus that builds up over time. As your dog chews through the green part of the tube, that's the bit that does the mechanical brushing of the tooth and removal of the plaque and tartar. And if I bring this in a bit closer for you, you'll be able to see the white sort of swirl, if you like, or wave looking component. That's the delmopinol, and that's the part that actually then coats the surface of the teeth after the plaque and tartar has been removed, and makes it harder for bacteria to attach to the tooth surface and start producing plaque, which then, as we've said, may progress to tartar once calcium in the saliva attaches. They come in different sizes. The one I'm holding in front of you now is for 11 kilos up to about 23 kilos. There are versions for smaller sized dogs, and there are also Oravet chews for larger sized dogs as well. And I'll just rotate it around so you can have a little look. So that's it side on. And then if we turn it around on the back, you can see it's just plain chew part. And they're quite flexible, and all the dogs I've offered them to, including my dog Jasper, do seem to enjoy them and are happy to chew through them. And you can see they do have to work a bit to actually chew through them. So you can see the dog's actually exerting some effort when they chew them. Okay, well, I hope that was of some use to those of you. And if you found this useful, please click the like button. It helps the algorithm determine whether or not this video has been useful for folks, and it will then show it to other people who hopefully it can help as well with their pets. And if you found the video useful, consider subscribing, because we will be producing more videos weekly from now on to help pet owners with their pets and share some knowledge and hopefully provide a bit of education or at least entertainment. Thanks very much. And just a brief disclosure, if I may. This channel is here to provide veterinary education and entertainment. It is not here to replace your personal veterinarian's advice on clinical matters.